Hello and happy belated Father's Day to all the dads. As you may know, June is Men's Health Awareness Month. So for the next 2 weeks, we will talk about the top health issues that men encounter. Today, we will begin with heart disease. Heart disease is the leading cause of death for men in the United States. And the most common cause of heart disease is coronary artery disease. Coronary artery disease simply means that the arteries that supply the heart with oxygen and nutrients are blocked or narrowed. As the narrowing of the artery increases, the heart is placed in jeopardy and may not receive adequate oxygen and nutrients, which is a setup for a heart attack. Heart disease killed 353,076 men in 2023, which equates to about 1 in every 4 male deaths. According to the American College of Cardiology, about 8.7% of white men and 6.7% of Black men and 6.8% of Hispanic men have coronary artery disease. If we look at the different racial groups in the U.S., it is a leading cause of death for African Americans, American Indians, or Alaskan Natives, Hispanics, and whites. And for Asian American or Pacific Islander men, heart disease is second to cancer. Just being a male make you more prone to get heart disease 7 to 10 years earlier than women. And did you know that erectile dysfunction and low testosterone can increase your risk for heart disease? It is important that you speak with your doctor about both disorders and the implications regarding your heart and overall health. Unfortunately, men are also more predisposed to some forms of stress and anger that can raise their blood pressure and stress hormones and ultimately reduce blood flow to the heart, thereby increasing the risk of heart disease. And what's shocking is that anger can have an immediate impact. Did you know that you're almost 5 times more likely to have a heart attack and 3 times more likely to have a stroke within the 2 hours after an angry outburst? So check yourself and ask yourself, is it worth it? And as Jeffrey Osborne would say, don't you get so mad about it? So now, let's look at the symptoms of a heart attack. They are often different in men and women. Men usually have chest pain, shortness of breath, and pain or tingling in the arm, shoulder, back, neck, or jaw. The chest pain is typically described as an uncomfortable pressure or squeezing sensation. On the other hand, women may experience dizziness, nausea, cold sweat, fatigue, and heartburn symptoms. And what's concerning is that half of the men who die suddenly of coronary artery disease had no previous symptoms. So in addition to erectile dysfunction and low testosterone, what are other risk factors for heart disease? There's hypertension, diabetes, obesity, being overweight, poor eating habits, physical inactivity, and alcohol use. Well, that's it for today. Join me next week when we will explore what you can do to reduce your risk of heart disease.